The reason there are two separate ways of placing those implants in the breast tissue is that they do have their own advantages and disadvantages. So the placement under the muscle is a very good placement. It's my preferred one. I rarely ever do them in front of the muscle, but sometimes I do. And the reason to put them in there is because the implants seem to have a protection against the capsular contraction. You're going to ask what the capsular contraction is. The capsular contraction is when your body forms a barrier around the implant. It always does. Sometimes this barrier gets to be very thick, and it tends to tighten around the implants, making them feel firm and unnaturally shaped. So one of the ways to avoid that is to place them under the muscle, which is why I do that most of the time. However, in the bad side is it tends to hurt a little bit more going under the muscle, and also if your muscle contracts it will give you a little bit of a distortion. And so one of the ways to avoid that distortion is to divide the inferior insertions of the muscle so there's not so much action into the implant as you contract the muscles. Now, there's some people that are very strong muscle, and they will experience various degrees of distortion with contraction. And so, especially, let's say, for people that do bodybuilding, they tend to have very strong muscles, and sometimes we consider putting them in front of the muscle instead. The placement in front of the muscle has some advantages. Number one, it hurts a lot less. Number two, it tends to look good right away. When we go under the muscle, the implant tends to be located a little high to begin with, and we have to wait for some time before the implant settles down into the right position. When it goes in front of the muscle, then the position will be immediate and the rewards will be instantaneous. However, the position in front of the muscle has a tendency to stretch the breast tissues more over time. And I've seen patients that after pregnancies, they have stretched their tissue a lot to the point where their breast sags, and they want to have corrective surgery for that. In that case, the correction will be to put them under the muscle and also to give the patient a lift so the shape and form of the breast will be enhanced further.